Hello and welcome to our presentation video for PHD225 group assignment. Today, we will be comparing two drugs that are commonly used to treat hyperparathyroidism, Cinacalcet and Etelcalcetide. This video is brought by Amirul Hakim, Muhammad Irfan and Naji bin Najhan. This is all the things we are going to discuss in our video.
Let's begin with the drug profile of both Cinacalcet and Etelcalcetide. Cinacalcet used to treat hyperparathyroidism and has a brand name Impara, Sensipar, and Cinacalcet are called pharma. It classified as phenylethylamine calcimimetic agent. It works by binding and increasing the sensitivity of calcium sensing receptor on the parathyroid gland to lowering the parathyroid hormone, leading to decrease in both serum calcium and phosphorus level in blood. On the other hand, Etelcalcetide, also used to treat hyperparathyroidism, as a brand name Wasabif, and it classified as synthetic peptide calcimimetic agent. It works by binding and activate the calcium sensing receptor at allosteric site on the parathyroid gland and decreasing the parathyroid secretion and calcium level in the blood.
For therapeutic indication, both drugs are used to treat hyperparathyroidism, a condition where the parathyroid gland produces too much PTH. This causes high blood calcium levels, affecting calcium absorption in digestive tract and kidney and phosphate balance in the body. Using calcimimetic agents like Cinacalcet and Etelcalcetide helps to trick the gland into sensing more calcium than there really is. As a result, it reduces PTH secretion, helping to bring calcium levels back to normal. Our treatment goal is to control calcium and phosphate levels and manage the symptoms of hyperparathyroidism.
Let's compare their clinical characteristics. Cinacalcet can be used in patients with both primary and secondary hyperparathyroidism. It also can be used together with phosphate binders or vitamin D steroids. However, Cinacalcet is not suitable for patients who are suffering from chronic kidney disease who are not on dialysis. This is due to the risk of hypocalcemia. On the other hand, Etelcalcetide is best for dialysis patients, especially those who have swallowing problems or poor adherence to oral medication. It's given intravenously, which is very useful for patients who have gastrointestinal intolerance.
Now, let's take a look at the pharmacokinetic on how the body processes these drugs. For Cinacalcet, absorption improves with food, increasing the bioavailability and peak plasma concentration. It has a large distribution of 1000 liters in the body and binds 93 to 97% to plasma proteins. It is metabolized in the liver by enzymes like CYP3A4, CYP2D6, and CYP1A2. It is mainly excreted in 80% in urine and others via feces with a half-life of 30 to 40 hours. For Etelcalcetide, in chronic kidney disease patients, it takes 7 to 8 weeks to reach a steady plasma level. It also distributes widely, approximately 796 liters, and mainly binds to albumin. It is not metabolized by liver enzyme. Instead, it transforms in the blood. It is excreted via kidneys or removed through hemodialysis with a longer half-life of 3 to 4 days.
Now, let's talk about how to use these drugs. Cinacalcet is taken orally, starting at 30 mg twice a day. The dose is gradually increased every 2 to 4 weeks until reaching the desired effect. The sequential doses consists of 30 mg twice a day, 60 mg twice a day, 90 mg twice a day, and 90 mg 3 or 4 times daily as needed. As for the administration, it should be taken with food to increase absorption. On the other hand, Etelcalcetide is given intravenously during dialysis sessions, usually 3 times a week, starting with 5 mg and adjusted every 4 weeks. For the administration, push into the venous line of the dialysis circuit at the end of hemodialysis sessions, during rinse backs or intravenously after rinse back. In terms of treatment duration, both drugs are used as long-term therapies to maintain stable PTH and calcium levels. However, for Cinacalcet, the discontinuation of treatment should be considered if it is not effective.
Both drugs can cause similar side effects like nausea, vomiting, diarrhea, joint and muscle pain, hypocalcemia, headache, and respiratory infection. In order for patients to handle this adverse effect, they must regularly monitor their blood calcium level, check Cinacalcet together with food in order to reduce the gastrointestinal intolerance, and if symptoms such as muscle cramp, tingling, or seizures appear, they should immediately report to their doctors. Patients also should be cautious with other medications such as CYP3A4 inhibitors because this medication can increase the drug level in their blood.
Let's move on to contraindication and precaution. Contraindication: hypocalcemia must be corrected before initiated, not approved for pediatric due to limited safety research data. Pregnancy FDA weight category C. Precaution should be avoided for patient with congenital long QT syndrome, patient with severe to moderate hepatic impairment, patient with history of seizure disorder, patient with risk of GI bleeding for Cinacalcet, patient with chronic disease that is not on dialysis for Cinacalcet.
For the interactions, Cinacalcet and Etelcalcetide both interact with other calcium-lowering drugs, which can increase the risk of hypocalcemia. Cinacalcet can also interact with CYP3A4 inhibitors, which increase its plasma concentration levels, and drugs metabolized by the CYP2D6 enzyme. Food can also increase bioavailability, so Cinacalcet is better taken with meals. For Etelcalcetide, since it is taken intravenously, there are no significant interactions between the drugs and food.
As for storage, Cinacalcet should be stored in between 15 to 30 degrees Celsius, protected from light and away from moisture. Meanwhile, Etelcalcetide should be refrigerated in between 2 to 8 degrees Celsius. Once the Etelcalcetide is removed, if it still remains in the original carton, it can last about 7 days. But if it is removed from the original carton, the Etelcalcetide should be used within 4 hours, below 25 degrees Celsius, away from the sunlight.
To conclude, both Cinacalcet and Etelcalcetide used to manage hyperparathyroidism in patients by lowering the parathyroid hormone, calcium, and phosphate level in blood. Cinacalcet used orally while Etelcalcetide used intravenously. Etelcalcetide has a little bit of advantages such as 100% bioavailability and less adverse effect compared to Cinacalcet. Recommendation as Etelcalcetide in dialysis patients that have issues in taken orally or experience GI intolerance, while Cinacalcet in patients that prefer oral therapy or not dialysis patients. Both drugs have different strengths and the best option depend on patient condition and preference.